Hello and welcome to NewsFirst Prime. This is Archana. COVID. This word still gives jitters to most of us. During those dark days and dark years, what came as a ray of hope were the vaccines, like Covishield and Covaxin. But the same vaccines today seem to have created a panic among people after its makers, AstraZeneca, have declared they have side effects. Today, we have with us an expert, a very renowned cardiologist who was also a part of our state's, Karnataka State's Special Task Force for COVID, Dr. CN Manjunath. Doctor, welcome to the show.
Yeah, thank you.
Doctor, what is your take on this? People are actually quite panic-driven today, and everybody who's taken Covishield, including me, want to know about the side effects of the vaccine.
Yeah, all of us have taken Covishield vaccine. Let me make it very clear in the beginning itself. Because there is lot of suspicion and lot of debate going on, particularly when this thing has appeared in the media that AstraZeneca has, presented before the court, it has some side effects. So I think Covishield or any other COVID vaccine contributing for heart attack or brain stroke is very, very negligible. It is insignificant. So that scare and fear should not be there among the people who have received any vaccine, whether it is Covishield or any other vaccine, for example, Moderna vaccine in the United States. If at all, if it has happened, the Covishield related complications, what is that complication? It can cause some blood clots in the artery. If it happens in the arteries of the heart, it can cause heart attack. If there is a blood clot in the arteries of the brain, it can cause stroke. If it is in the lungs, it causes pulmonary embolism. Or if it is in the arteries of the leg or hand, it can cause little bit of ischemia of the legs and all. But for every 10 lakh vaccinations, Covishield, 5 to 6 people might have suffered these complications. This number, that means for every 10 lakh vaccinated people with the Covishield, maybe 6-7 people might have had this complication. If at all, if this complication occurs, it should occur within the first 3 months of vaccination. The take home point is, it should happen either within the first 3 months or maximum up to 1 year. But 99% of complications, if at all, if it is occurring, it should occur within the 3 to 6 months. So in India, we have received vaccine, the booster dose about 3 years back. So that scare should not be there, that fear should not be there. See, always, I think we should thank the scientists who have discovered, who have developed this vaccine. We should also thank the manufacturers who could able to make this vaccine in such a bulk proportion. So because in India, 80 crore populations were vaccinated, 80 crores. Yes. Nearly 270 crore vaccines were given for Indians, including first dose, second dose, and also booster dose. Yes. So 270 crore vaccines were given to 80 crores Indians. Yeah. So this always, because of this Covishield vaccine or any other COVID vaccine, the third wave in India was aborted. See, first wave, yes, unprecedented infection and so many deaths. Even second wave, Delta, was also very, very scary, and lakhs of people died in the second wave. See, for example, in America, only 40 or 50% of the population received vaccine. While in India, nearly 90-95% received vaccine. See the difference. In America, there were waves after waves. Third wave, fourth wave, fifth wave, sixth wave. The COVID deaths in America was much higher than in India. So even WHO has appreciated the way India has managed COVID, the way India has vaccinated its people. So this is where you have to look at this particular issue from a scientific angle. See, what is a good medicine? If benefits are more than the risk, it is a good medicine or a good vaccine. See, because of this vaccination, in the third wave, the ICU admissions were remarkably less, and number of deaths were also very, very few. and only those who had comorbidities, who had other terminal illnesses did succumb. So I think definitely vaccine has done a lot of good to people, and the one should not be under the impression all heart attacks that is happening is because of Covishield or because of COVID infection. I will just give our own data. Between 2014 to 2019 at Jaydev Institute of Cardiovascular Sciences, we conducted a heart attack study, heart attack in the young. I am talking about pre-COVID. Between 2014 to 2019, that is over a period of 5 years, we have treated close to 5,500 young heart attack patients between the age group of 18 to 40. So, if you look at the trend, if you look at the growth of heart attack and related disease in India over last 20 years, there is 22% increase in the prevalence of heart attack and its related disease in India. I am talking about pre-COVID. So, one should not think everything is going up because of COVID or Covishield. That is a wrong perception. And what has happened recently in the last 3-4 years, some people from the high profile family have died in the younger age group. So, that has caught the attention of the people and caught the attention of the media. For a cardiologist and for some physicians, this is nothing new. Okay. Because this is all happening because of modern lifestyle. Food habits have changed, food products have changed, there is a lot of stress. I think everybody, whether rich and poor, working, non-working, everybody has their own levels of stress, and physical inactivity, smoking and excessive drinking, and high increasing prevalence of diabetes and high blood pressure in India, air pollution. I think all have contributed to this. Yeah. So, that is the reason one should not be under the impression. So, because if this AstraZeneca has filed its affidavit before the High Court in London, before this thing, this has created some ripples because it has appeared in the media that Covishield can cause blood clots. Yes, it is very, very insignificant, but the time window is over. Okay. The vaccine, Covishield or any other COVID vaccine, if it is going to cause the blood clots, it should happen within the first 3 months or 6 months. So, we have received 3 years back. So, that issue is not there.
But people also feel that there's a sudden increase of heart attacks after the vaccination. Is that true?
No, it's not really true. It's not really true, because I just gave our own study between 14 to 19. So, it is growing because and there are some incidents where people were dancing, they suddenly collapsed. See, there are so many other causes of sudden death other than heart attack. Okay. There are other causes of sudden death other than heart attack. Even there are non-heart attack cardiac causes of sudden death are there. Non-heart attack cardiac causes of sudden death. I think there is one entity called hypertrophic cardiomyopathy, where by birth itself heart muscle thickness is increased, and it runs in families, and they can die suddenly. Okay. And they may not be having any symptoms. There are many hidden heart diseases other than heart attack that can cause sudden cardiac death. So, there is one entity called right side of the heart, there is enlargement that comes by birth. We call it as arrhythmogenic RV dysplasia. So, people can die suddenly. And there are some electrical abnormalities of the heart. Heart is a current. Okay. There are electrical abnormalities of the heart, and there can be short circuiting of the pulse or impulse within the heart. As a result, heart rate normally normal heart rate will be around say 70 to 80. With anxiety, it can go up to 90 or 100. All of a sudden, heart rate which was 70, 80 becomes 300, 250. They die suddenly. This is due to electrical abnormality of that. So, for a common man, when somebody dies suddenly, we always think it is heart attack. It is correct. But there are exceptions. There are some other cardiac diseases other than heart attack can also give rise to sudden cardiac death. Particularly this hypertrophic cardiomyopathy I'm talking about, where heart muscle becomes very thick. So its prevalence is 1 in 500 in general population. Every 500th person in the general population has this problem. It runs in families. So
it can be genetical also.
Yeah, it is absolutely genetic, and I have seen families of 4 and 5 people having this and 2 dying suddenly. So these are some of the issues we have to look. But definitely vaccination has made a remarkable positive impact on the outcome of COVID and also the control of COVID infection in India.
Yeah. But this topic, doctor, actually just come to the surface now. But otherwise also for the last few years, what I have been speaking to people and all that, they've always, this topic was always there in their mind, saying that after vaccination, they're like probably experiencing a sudden shoot up in their sugars, or their joint pains have increased, or sudden dizziness, or they suddenly just fall off on road. And does this anything related to the vaccination or corona?
Yeah, even the corona or COVID infection during its active phase itself was causing blood clots.
Okay.
Yeah, during active phase of COVID infection or corona infection, few people have died because of heart attack or because of blood clots in the lungs, what we call pulmonary embolism, or even they have suffered a stroke. And during that time, we have seen some patients developing blood clots and low platelet count. That is the, the report they have given. It can cause blood clots and low platelet count. That is thrombosis with thrombocytopenia. That is the report they have placed before the court. So, see, this post-COVID, we talk about what is called long COVID syndromes, long COVID problems. So, after having suffered from COVID, some people have developed fibrosis in the lung. Normally, lungs should be like a sponge. So when it becomes hard, they will have shortness of breath, they will have breathing difficulty, and also their physical activity is limited. Even after walking couple of floors, one first floor or second floor, they become breathless. So that is known. That is one of the problem of long COVID syndrome. And some people I have seen complaining of loss of hair and allergy, some joint pain and this thing, and diabetes. So those who have suffered from COVID, few people have developed diabetes. One of the explanation why they have developed diabetes, there are because of 3 reasons. One, this coronavirus can directly affect the pancreas. That's where insulin is released. That is one. And for very sick corona patients, steroids were given. Steroid can cause diabetes. And third is those who are pre-diabetic at the time of getting COVID infection, they have become diabetic. So these are some of the things, loss of hair, sometimes loss of maybe impairment of memory or cognitive function, and diabetes, and few might have developed what is called myocarditis, where heart muscle is affected. These are all consequences of long COVID syndrome.
So it's basically because of COVID and not because of the vaccine.
Not because of the vaccine, but vaccine effect, if at all, if it is happening, it should happen within the first 3 months of vaccination, or even if you stretch it, it could go up to 6 months, 1 year. But 99% of vaccine related issues should occur within the first 3 months of vaccination, and the time window is over. So we Indians should not bother. Even any other people outside India also should not bother about this.
In case people have a doubt, doctor, like because of vaccination, whatever condition they are in, is there any mechanism to detect? Is it like something it's happened because of the vaccination or something?
No, only you can do a general cardiac checkup.
Okay.
General health checkup can be done. See, most important, one should not always think about, okay, I have taken Covishield vaccine, whether I can get heart attack, whether I can get the stroke and all. So you have to take general health measures. Quit smoking, and should not consume alcohol, quit smoking. Excess alcohol intake is always bad, okay. Then physical activity, and if you are having diabetes and high blood pressure, you have to manage optimal control of blood pressure, optimal control of diabetes, and you have to keep your weight within those limits. Food habits should be good. You should consume more fruits, vegetables, and so these are, and physical activity, walking for at least 45 minutes to an hour daily. So these general measures should be followed. Otherwise, what happens, one should not always think if it's anything happening in your body, it's all because of this Covishield.
Yeah. But do you think because of the sedentary lifestyles, because during COVID people were not allowed to go outside or even take a walk, and of course the increase of alcohol consumption also, do you think that has affected the current rate of heart attack?
No, that is physical inactivity is one of the cause for all lifestyle diseases, whether it is a heart attack or diabetes or high blood pressure or stroke, physical inactivity. But actually, COVID as such, that acute phase, I have already said that it can cause so many problems. It can affect lung, it can affect heart, it can affect brain, all those issues. But generally, you should take general precautions, and you should go for best practices. I mean, lifestyle should change, and food habits and food products, you should low on sugar. That's the reason you should always take care of 5 or 6 S, we say 6 S. One is salt, stress, spirit, smoking, sedentary life, and sugar. Take care of 6 S.
Yes.
In general, it's good.
Yeah. And for people who have not taken Covishield, for instance Covaxin, are they safe? Do they also have side effects?
No, if at all, if it's happening, it should also happen within the first 3 to 6 months, not beyond.
So either ways,
any vaccine, not only this COVID vaccines, any vaccine for that matter, have that inherent risk. The problem is, see, if there is a drug which has a lot of benefits, its efficacy, safety is 99.99%. So it's a life-saving drug, we call it as. So 0.001%, if it has a side effect. Now what is happening? The media as well as public are giving attention to this 0.001% of side effect, but not really appreciating the 99% of its benefits, 99% of its life-saving properties.
And now actually we've also seen a rise in the heart attack of kids also. What do you think is the reason?
Kids means?
Kids around like 16, 17 years, that and of course the increase of mobile watching also has increased. Do you think that is related to this?
I think we don't know. So whether it is really a heart attack, because there can be other heart diseases, unless we really evaluate them, we don't know. But one thing is certain, this consumption of these narcotic drugs among the college students in bigger cities, it is on the rise. Narcotic drugs, madaka vastugulu antivalla, narcotic drugs, maybe marijuana, cocaine, and some teenagers going to bar. It can cause sudden heart attack. Those things are there. So definitely, but stress is a very important. Today, stress is considered to be a new tobacco. Stress is equivalent to new tobacco. So I think stress management is extremely important. And among the youngsters, what is happening? Their expectations are too high, trying to do too many things in too short time, trying to achieve a particular thing which requires around 10 years to achieve, they want to achieve in 10 months. So as a result, they are subjected to very high stress levels. See, you have to, yes, you should have expectation. See, what is stress? Stress is a gap between expectations and performance. So if expectations are unrealistic, then you are going to unnecessarily suffer from too much of stress.
Okay. So what is your advice, doctor, to the people?
So my advice is, people who have received Covishield vaccine should not bother about it, okay? So because of this particular thing which has cropped up again, the Covishield related vaccine complications is very rare. It is very insignificant number, and if at all, if it is happened, it has happened within the first 3 months of vaccination. And since we have all received this vaccine about 3 years back, its effect will not be there. And be confident and be positive and be bold, and don't listen to various other fake stories about this. And I think we have to thank the manufacturer, thank the scientist for giving that. Otherwise, it would have, see how many lives this vaccine has saved. See, that's what you have to look at. How many lakhs of lives have been saved? How many lakhs of people have been prevented from going to ICU? So those we have to give importance to that. So the benefit to risk ratio, it's always in favor of these vaccines.
Okay, doctor, thank you so much for being on the show and just giving us an insightful talk about this. I think it has definitely helped our viewers also, and they should feel safe now. They're already in safe zone after so many years. Thank you so much for being on the show, doctor. Thank you.